Hello, everyone. My name is Zoran Dogas. I am a medical doctor and neuroscience professor at the University of Split School of Medicine, and I'm also a certified somnologist, expert in sleep medicine by the European Sleep Research Society. I will be telling you just basic information on the classification of all sleep disorders. And in the second half of this short lecture, I will tell you a couple information about sleep medicine in the EU as far as education and perspectives. So far, we had two previous ones and the actual one, International Classification of Sleep Disorders. So number 3 is actually here what we use globally. It was published by the American Academy of Sleep Medicine, replacing the previous edition. In the ICSD-2, we used to have about 80 sleep disorders, which is probably more numerous than the average person would expect. Today in the ICSD-3, it is organized in a way that we have like 6 main clinical divisions or 6 categories. Number 1 is insomnia, which is very prevalent, and we believe there is about 10 to 15% of people, in general population who suffer from insomnia. Then number 2 is sleep-related breathing disorders, among which the most famous actually is sleep apnea, mainly obstructive sleep apnea. And this is the main reason why people come to sleep labs or sleep centers nowadays, not only in European countries, but globally, worldwide. Number 3 is central disorders of hypersomnolence. Number 4 is circadian rhythm, sleep-wake disorders. And then number 5 is parasomnias, and there is additional, separate category now, sleep-related movement disorders, including restless leg syndrome or similar. And then there is always a need to have extra category, and this is actually what we call other sleep disorders. But just for illustration, how it was differently organized in the ICSD-2, in the previous edition of the International Classification, and this actual one. In ICSD-2, you had several different areas. Dysomnias was one important area, and then it had several, parts. For example, intrinsic sleep disorders shown here, and there were several types of insomnia here, like psychophysiologic insomnia, idiopathic insomnia, and maybe some more. If you go to extrinsic sleep disorders within the same area of dysomnias, you also had couple insomnias here. For example, altitude insomnia or food allergy insomnia, etc. And then if you move to another area like sleep disorders associated with mental, neurologic, and other medical disorders, you could also find some type of insomnia. Here, this would be fatal familial insomnia. So in general, all in all, if you look at all types of insomnia in previous classification, we had about 11 different types of insomnias, which is quite confusing and quite heterogeneous group of sleep disorders. In the present classification, we have insomnia as a first out of 6 categories that I just shown, and now we separate them. We divide them only in 2 separate categories. One is chronic insomnia disorder, and the second one used to be acute insomnia disorder. Now we rather use the term short-term insomnia disorders. And then, of course, there is another need, for some separate, types of special types of insomnias, and this is what we call other insomnia disorders. So the classification is much easier than it used to be, and one of the reasons was that the treatment, diagnostics and the treatment was very much similar, regardless of one of 11 different types of insomnias. And now there is actual revision for ICSD-3, and insomnia disorder is again a little bit simplified, here, as well as maybe some other categories like sleep-related breathing disorders. So this is just for the illustration how dynamic, this area is, dependent, of course, on new research, new knowledge in this area, and of course sometimes even for educational purposes or the training of or sleep professionals. Okay, so the prevalence, in those 6 categories, I said insomnia could be probably on top, but the most numerous group actually, as far as patients coming to sleep centers or sleep labs today worldwide, globally, not only in European countries, is the sleep disorder breathing or sleep disorders relating to breathing issues. And among them, the most prevalent is obstructive sleep apnea. We now believe that close to about 1 billion people suffers from obstructive sleep apnea, or maybe sleep apnea better in general. So anyhow, there is a huge need and very highly prevalent group of disorders that belong to this area of sleep medicine that is covered by sleep medicine, sleep disorders. But despite, this fact, we still have huge, great diversity among different countries in Europe as far as development of sleep medicine as a medical field. But this is more than medical. This is, I would rather use the term interdisciplinary field. We have totally different systems as far as, status of sleep experts and recognition of those. We don't really have specialty in sleep medicine. As of yet, we now have negotiations with the European Medical Specialties, the roof body, which is covering all medical specialties. So we hope to have sleep medicine very soon recognized as subspecialty, maybe in the future as a separate specialty. So there is a difference with regard to education and training, but also the way we practice sleep medicine. And of course, reimbursement systems as far as healthcare in different countries have different ways how they actually reimburse diagnostic procedures in sleep medicine and also therapy for sleep disorders. So therefore, we have a great need for standardization, and this is what we do. We put a lot of time and energy at the European Sleep Research Society, which also includes the Assembly of National Sleep Societies covering about 30 European countries, to standardize everything within the sleep medicine. We did some things, but there are many things still open. So for your information and within this course, it would be nice that you have this perception about the whole area. So what has been done so far in those levels was mainly done within the Assembly of National Sleep Societies of the European Sleep Research Society as a roof organization. Now in the Assembly of National Sleep Societies, which includes over 30 countries in Europe beyond the EU, we still have several countries from outside the EU. Assembly was having executive committee, and those group of people were very active in putting up some standards to improve the present situation with regard to sleep medicine. So back in 2006, which is almost 20 years back, the group came up with guidelines for the accreditation of sleep medicine centers, and this is now revised. And but important information is that if you want to form the sleep medicine center in Europe, you must follow the European guidelines for accreditation. We also start some years ago, about 16 years ago, bringing up the guidelines for certification of professionals. As I said, there is no medical specialty like surgery, pulmonology, endocrinology, ENT, neurology, neurosurgery, whatever, that covers sleep medicine as well, but sleep medicine is dispersed within different specialties. And now we have ongoing initiative to become recognized as interdisciplinary medical area, but also in the future, hopefully, separate specialty and subspecialty as sleep medicine deserves to be. We also, about 13 years ago, we published a paper, and so far, in the last 12, 13 years, we work extensively to improve the standard procedures and to disseminate knowledge how this should be done in all accredited European centers for sleep medicine in adults. In pediatric population, we don't really have such strongly developed guidelines, and we still struggle a little bit with those. But there are many people who work actively on putting together standards for pediatric population as well. And then there was an issue how to train people in this area, so we came up with the idea of having a catalog of knowledge and skills for sleep medicine and to develop the learning outcomes and everything to cover this area. Within the catalog, we first identified 10 different sections, and then we broaden, some sections linked to other medical specialties. So this is just the intro into the first catalog of knowledge and skills edition and how it is done. And this was the basics for the training in sleep medicine in Europe. So in this area, we envisioned the way how to educate people properly in Europe in sleep medicine. And this is the idea which we used as background for developing master's degree programs. 1 year full-time equivalency, 60 ECTS credits, and this is what European Society has as the best or the gold standard. And for this purpose, we published the first textbook in Europe about 10 years ago, and now we have second edition which is being used. And within the society, there is preparation, and the work is ongoing for the third edition of the European, but I would say not only European, but the global sleep medicine textbook. And this is how it looks like inside, several sections. The second edition was published in 2021, so about 3-4 years ago. There were many public activities to increase the public awareness with regard to sleep medicine and especially sleep apnea, because some people, consider not only hypertension to be silent killer, but also this is the term we use for sleep apnea. But sometimes, when people are snoring, producing sound, so it is not so silent. The silent killer being obstructive sleep apnea. So this activity here shows many European countries joining the Wake Up Bus initiative, and the final destination for this initiative was EU Parliament. And now, ever since this initiative and linked to this initiative, the European Commission issued directive on the driving license. So if you have high risk for sleep apnea, or if you have diagnosed sleep apnea, and if you are not treated, you cannot really get driver's license to operate motor vehicles within all the EU countries. And then finally, just a couple information. Due to activities done at the European level and the master's degree program at the University of Split, which is our background here, we developed the master's degree program, sleep medicine, which is taught in English as the official language, with quite international teachers. And of course, it's open for all, not only European countries' citizens, but also for those, from international, global, worldwide, actually, regions. So we have developed the master's degree, so we have special education in this, and these are just insights, in the content, so it is organized the same way as all our study programs are. So anyhow, to conclude, I hope you got some overview of this area with regard to classification of sleep disorders and some ongoing activities, within the EU, European countries, to develop standards which would cover all areas, education, research, training, and of course practice. But there are still many, many things to do. So this is just the final message from my side. As you get older, as you grow older, I would say, you get more and more realistic. So this is something that I would really love you to take as a home message, from this. Good luck with the course, and thank you very much for participating in this eSleep D-Health initiative, in this project, and also in this education. Thank you very much. Bye-bye.